Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Today I would like to discuss testing for hepatitis C virus infection. In the United States, it has been estimated that greater than 4 million individuals have been infected with hepatitis C, and it is estimated that the chronicity rate of hepatitis C is approximately 75%, indicating that about 3 million individuals are infected at any given time. There have been considerable advances in the diagnosis and treatment of hepatitis C, and the CDC has recommended testing of certain groups of individuals for evidence of hepatitis C by screening for hepatitis C antibody. Among those for whom antibody screening has been recommended include anyone who was born between 1945 and 1965, anyone who has ever injected drugs, anyone who received donated blood before 1992, and healthcare workers exposed to blood on the job through a needle stick or injury with a sharp object. Once an individual is infected with hepatitis C, the antibodies to the virus are detected lifelong. There are several technologies for testing for antibodies to hepatitis C. The simplest is testing an FDA-waived immunoassay for hepatitis C antibodies. This has a sensitivity of 95%, which is comparable to the FDA-approved immunoassays conducted in large laboratories. A positive antibody immunoassay cannot distinguish, however, between active or resolved infection, and therefore HCV RNA detection in the blood is necessary to determine the presence of chronic infection in a patient. Remember, a patient with hepatitis C has a 75% probability of being infected lifelong. If the immunoassay is negative, you also need to keep in mind that a negative immunoassay in a patient suspected of recently acquiring the infection must be repeated at 6 months because antibodies may not be initially apparent, although generally antibodies are detectable 4 to 6 weeks after infection. Also, immunocompromised patients may have a false negative result, and in these cases, follow-up RNA assay is indicated in the face of a negative immunoassay. In the accompanying algorithm is the CDC recommended testing sequence for identifying current hepatitis C virus infection. If the hepatitis C antibody screen is negative, the patient is considered non-reactive and no hepatitis C virus antibody has been detected, and generally RNA screening is not needed unless the individual is immunocompromised. However, if the hepatitis C antibody test is positive or reactive, hepatitis C virus RNA must be looked for. If the hepatitis C virus RNA is negative, meaning none is detected, there is no current hepatitis C virus infection, and generally nothing else needs to be done. However, if the hepatitis C virus RNA is positive, then the patient has current hepatitis C infection and should be referred for medical care. Thank you for your attention.